Hello everybody, so this will be your lecture video over Unit 3, Section 1. I'm going to switch on over and let's get started. Okay, so Module 3 is about just about stretching, how to stretch people, why we stretch people. And so the whole point of stretching is just to increase either muscle length or joint range of motion or both, right? So we use it as a tool. I know you stretch like before basketball games and things like that to kind of loosen up muscles and kind of get them warmed up, but that's not the main reason for stretching, really. Stretching, when it comes to our skills as a PTA, is really about improving range of motion. Okay, so if somebody comes into you and the PT assesses them and they say this person only has 90 degrees of knee flexion, and you know that normal knee flexion is around 135 degrees, functional knee flexion is somewhere around 110, you know that you've got to improve range of motion in that joint, right? So it may be a joint problem that's keeping that knee from moving. It might be a muscle length problem. And if it's one of those two things, we can work on that with stretching. If it's something that's damaged or there's a bony block or something like that, then they're going to have some type of surgery or something like that. So anyways, stretching is just how we go about doing that. It's about taking the muscle and making it as long as you can get it, right? And so you're taking origin and insertion and separating them from each other with the muscle. The terminology of stretching, or just some terminology about muscles actually that you need to understand, are terms like elasticity. This just means that soft tissue and muscle all has this ability to kind of spring back to its original shape after you stretch it. That kind of fights against us, but it doesn't just have it doesn't just have elasticity, it has viscoelasticity as well. um, when you stretch, it's able to change length. So just like the band in your pants or shorts or whatever, it gets longer, but then will still kind of go back to its stretched state. Muscles are weird though, because they don't just have elasticity and viscoelasticity, which are very similar. They also have plasticity. So if you take muscles and soft tissues and you stretch them and hold them for a long enough time, they will actually start to lose their shape. And this is actually kind of like a waistband too. If you pull something elastic and hold it apart for long enough, eventually that elastic starts to kind of wear out, right? And you see it in your socks and things like that, where they get old and floppy, like the wizard sleeve that we joke about in class. So those are just some of those concepts of how muscles work, and we have to be aware of that. Plasticity is why we have to hold our stretches as long as we can. The longer we're able to hold a stretch, the better it's going to work to pull it and make the muscle actually change shape, which is what we're really going for. A contracture is just what happens to a muscle if it stays in a shortened position for too long. The muscle fibers will kind of bind together and you won't be able to move that joint as far. So if any of you who have ever had to have a splint or a sling or a cast and had a joint stuck in a single position, when you took that cast off, you found I can't fully extend my elbow or my hand. I still have some issues with my finger from when I broke my metacarpal, because I had to have my hand in that position for 6 weeks. So anyways, that's what a contracture is. It's the fibers of the muscle, from being in a shortened state, begin to kind of like bind together. It's kind of like a gate that you don't move for a long time and it starts to rust together. And to get it moving again, you got to get in there and start just working it. And our joints are much the same way. Hypomobility just means there's not enough motion at a joint. It doesn't go through the full normal range of motion. Those normal ranges, we learned it in 125. Hypermobility means a joint moves too much, right? And so you don't want to stretch beyond normal range of motion. We kind of talked about that in 125. Here it's really important because hypermobile joints cause dangers. They're higher fall risk, they're more risk for even damage to the joint. So we want to not have hypermobility. So when we experience hypermobility, we need to strengthen those muscles and actually reduce range of motion a little bit. Indications for when you should stretch somebody, if range of motion is limited, right? Basically, so if they don't have enough range of motion in a joint, in general, not always though, but in general, you want to stretch that joint. It can be caused by adhesions, where when the joint is healing, it basically builds up kind of like scar tissue and things like that, contractures, which we talked about. Scar tissue formation, as it's kind of a little bit redundant. Any of these things can cause the joint to not have the full range of motion that it should. If that's the case, that's a good time for stretching. When restricted range of motion when restricted motion may lead to structural deformities that are otherwise preventable. If somebody sits in a wheelchair all the time because they have to, it they'll what will happen is they're used to sitting with that knee flexed and with their trunk actually flexed a little bit forward, and their hips obviously flexed forward as well. And because of that, all those muscles can get tight and stuck in that flex position, and that's going to prevent them from being able to do like normal transfers and things like that. Does that make sense? And so we need to improve that range of motion, and we're going to need to stretch them fairly often to prevent them from losing functionality in other situations. When there's muscle weakness and shortening of opposing tissue, sometimes one muscle is overly strong, which causes and weak in another area, which causes not full range of motion, basically. So basically, it really boils down to anytime there's not full range of motion, you're going to want to stretch somebody unless there's an underlying cause for it, and we'll look at that in a little bit. Once again, I did talk about earlier, stretching is good for preventing injuries. That's why athletes stretch a little bit before exercise, kind of wakes the muscles up and warms them up a little bit, and it does reduce pulls. You have to be smart in how you do it though, because it can actually reduce effectiveness if you stretch too much. After vigorous exercise to potentially minimize post-exercise muscle soreness. It's good to do after stretching after exercise. There's some indication that it actually is more beneficial than stretching even before exercise. So some precautions, some things to be aware of. Don't stretch somebody past the normal range of motion. We've talked about that, not just in 125, but already in this video. Protect fracture sites. If somebody has a bone break, don't stretch that body part, basically, right? Because you're going to be putting stress on that fracture and pressure on that fracture, and you don't want to keep the bone from joining together properly. So when somebody has a bone break, you don't want to stretch them. If soreness lasts longer than 24 hours, the intensity was too great, right? So what's funny is stretching is actually in a sense like strengthening, in that you're actually causing a little bit of tearing in the muscles, right? Those muscle fibers have started to grow together and form a little bit of a contracture, and when you're stretching, you're literally actually pulling those muscle fibers kind of back apart, and so it is micro tears. So you don't want to overstretch either, because people can get sore from it, and if it lasts more than 24 hours, you did too much. There are times when you just absolutely can't um, do stretching. If there's a bony block, right? I talked about this. You're not going to be able to stretch beyond that, and you're going to actually cause the patient pain and maybe even cause breakage in there. Um, so if you feel a hard infield where you know there shouldn't be one, or even where there should be one, you don't want to stretch past that hard infield. So anytime there's a hard infield, that's it. Like that's where stretching stops. That's where joint range of motion stops. After a recent fracture, kind of goes back up to here. Um, you have to wait until that bone heals before you can do stretching. If they're in the acute stage of injury, and I don't know if you guys went through in Jennifer's class the phases of injury, but we will actually talk about those some in here. I think you guys did, though, actually in 150. But when people are in the acute phase, like within the first 72 hours or sometimes even longer after an injury or a surgery, or if there's any signs of infection, you don't stretch them, because you can make the symptoms worse. You're increasing blood flow, you can cause the infection to spread, you can cause extra blood flow and fluid flow into the area, so an already swollen and hurt area that's painful will become even more painful. So that's no good. If you're stretching somebody and they say, oh my gosh, like all of a sudden out of nowhere, there's a really sharp, acute, all of a sudden out of nowhere pain, then you got to stop, right? Because something has pulled or something's not right in that muscle. If there's bruising, a hematoma is just under the skin blood, which is a bruise. If there's indications of trauma in that area, you don't want to increase that blood flow, right? You don't want to make it worse. If the joint is hypermobile already, we don't want to stretch it more. We don't want to make it even more mobile. That's bad for the joints, bad for the person, increases risk of falls and things like that, like I said. Now, here's an interesting one. When contractures or shortened soft tissues are providing increased joint stability in lieu of normal structural stability or neuromuscular control. There are times when people have neuromuscular conditions, CVAs, brain damage, and things like that, where the tightness is actually a good thing because it's protecting the joint overall in a way that it would be bad to reduce the risk. Or sometimes it's even actually functional. And I don't know if you guys have talked about tenodesis before, but it's a type of shortening that occurs with certain types of trauma. But like if somebody has a spinal cord injury, at times you'll see their hand get stuck in kind of a flexed finger position. And if you take that person's hand and stretch it into extension so that their hand's in a better normal position, all of a sudden they won't be able to like hold a toothbrush or hold a spoon, right? And so it's functional for them to have that flexion contracture in their fingers, and so to stretch that out would actually make things worse for them. Make sure that the patient is dressed comfortably, that they're able to stretch without the clothes impeding and causing damage, basically. So make sure they're wearing nice, loose-fitting clothing. Oh, sorry, I missed some of the contraindications. I skipped down parts. Sorry, guys. Finally, when increased functional abilities, this is what I was talking about with tenodesis, right? So there are times when contractures are actually helpful. They either protect the joint or they allow functional activity. And so in those times, you don't want to stretch. So preparation for stretching, right? How do you get ready for stretching? Review the plan of care and the goals and outcomes. Select a stretching technique that will be most effective and efficient for the patient. If they're in, just basically pick a stretch that's going to work, right? Warm up the tissues, if you can ahead of time. This really helps. Put a hot pack on the area that you're going to stretch. It increases blood flows. It even improves that plasticity effect that we talked about earlier. It allows the muscles to stretch easier, and you're just going to have an easier time of it. So make sure the patient is in comfortable and stable position, right? They need to be comfortable because you're actually going to be stretching them. There's going to be a little bit of pain. Make sure they're set up and comfortable and safe. Um, just know that the direction of the stretch is the opposite of the direction of the muscle actions, right? So what all that's saying is if you're trying to stretch the biceps, right, you don't want to stretch them into flexion, you want to stretch them into extension. And so to get a good stretch of the biceps, you have to fully extend the elbow and extend the shoulder as well, so that you're getting a good stretch on those muscles that cross two joints, right? Um, Make sure patient is dressed comfortably. We already talked about that because I got lost. The patient must also be as relaxed as possible. If the patient, our body actually will naturally fight stretching a little bit, and if the patient is already naturally fighting you and not relaxed and not working with you, it can cause real problems. So make sure you get the patient to kind of calm down, relax, build a little bit of rapport with them, explain what you're going to do ahead of time, and don't just jump into it. After stretching, apply cold to the tissues that you've already stretched. This will actually help the muscles to kind of tighten, but in that lengthened position. And so that can really help. And it can also reduce the risk of muscle soreness from the micro traumas that we cause. Um, Strengthen any new range that's acquired. So all that's saying is like, once again, if we're doing biceps flexion, extension, right? We're trying to improve extension. We're stretching the biceps, and that person has, negative 20 degrees of extension. They're 20 degrees short of zero. Once you get them to zero, make sure that you're doing things to strengthen the triceps in that new area, if that makes sense. Maintain a balance in strength between the agonist and the antagonist muscles, right? So make sure that you don't have one side of a muscle and stretching action that's stronger than the other, basically. You want to make sure that the antagonist and agonist work together and are pretty balanced. Okay, so we don't want to have too strong a bicep, too weak a tricep, or vice versa. So anyways, here's a video where I kind of just go through manual stretching, and then that's kind of it for this section.